So people, in this video, let us look at acute DaCryoCystitis. What is DaCryoCystitis? So basically, it is the inflammation of the lacrimal sac. Right? In the previous videos, you have seen the anatomy and all that. So here you have the lacrimal sac. So this is getting inflamed, right? So if there is an acute attack or a sudden attack of this inflammation, that will be called as acute DaCryoCystitis. So now let us look at this. It is an acute suppurative, that is pus with pus inflammation. Okay. So basically, there will be painful swelling at the region of the sac. Which sac? Lacrimal sac. Let us look at the etiology of this. Acute DaCryoCystitis, it may develop in two ways. There can be a chronic DaCryoCystitis which will have an acute episode. Acute exacerbation of chronic DaCryoCystitis. So did you understand, guys? Chronic DaCryoCystitis, all the time, eternally, they will have chronic DaCryoCystitis. In that, suddenly an acute attack will be there. Acute exacerbation of this chronic DaCryoCystitis is one of the cause. Okay. Then, which is the other cause? Acute peri-DaCryoCystitis due to direct involvement from the neighboring infected structures such as the paranasal sinuses surrounding bones, dental abscess, caries teeth and upper jaw. Okay. An acute peri-DaCryoCystitis. Peri means around, right? So, around this area, some infected structure, okay? Neighboring structures are infected, such as what are infected? What could be infected, right? Paranasal sinuses, right? Paranasal sinuses, surrounding bones, dental abscess, caries, right? Caries teeth in upper jaw usually, okay? So what are all these called as? Acute peri-DaCryoCystitis, okay? So all these can cause what? An acute DaCryoCystitis. Then, some organisms which are involved in this attack. So you can have Streptococcus hemolyticus, pneumococcus and staphylococcus. So you've already seen these in all other cases. Streptococcus, pneumococcus, staphylococcus, right? All these organisms are usually involved. Streptococcus what? Hemolyticus. Okay. So all these organisms can cause this acute DaCryoCystitis. So guys, now we have some topics to cover here, like we have to look at the clinical features of this acute attack of DaCryoCystitis, then complications, and then we have to look at the treatment. Obviously, we have to look at the treatment. Okay, and then we have, okay, so let us look at these clinical features, okay, of acute DaCryoCystitis. So we have taken these two images from Dhingra. Let us look at these here. So basically in clinical features, guys, in clinical features, what you should know is, there are three stages here. Stage of cellulitis, stage of lacrimal abscess, and stage of fistula formation. So look at the photo here. So here you can see the abscess full of pus. Then here you can see it has burst open to leave a fistula, abnormal opening, right? So these are the second and third stages. So what is the first stage? Stage of cellulitis. So painful swelling associated with epiphora. Epiphora means outflow is blocked, correct? Painful swelling will be there. Epiphora. Fever can be there, malaise. The swelling will be red, hot, firm, tender. Redness and edema will also spread to the lids, that is the eyelids and cheek. Okay. So at this stage, if you treat, resolution can occur. Okay. If it doesn't, if you don't treat, self-resolution is very rare. Okay. Then it will go to the stage where lacrimal abscess. So continued inflammation causes occlusion of the canaliculi. So there will be occlusion of this. Now it has got, there is swelling. So what will happen? There is swelling. So the canaliculi get occluded. So there will be, the sac starts getting filled with pus. It distends and its anterior wall ruptures, forming a pericystic swelling. So now what happened? This abscess got formed. Usually it will be pointing below and outer side of the sac. So it will be pointing below. So if this is the lacrimal sac, it will be below and it will be pointing below and outward. Okay. Downward, outward, below and outward. Okay. Because of gravitation of the pus, right, and presence of this medial palpebral ligament in the upper part. So because of that, it will point down, below and outward. Okay. Now what do you think will happen? After this abscess is growing, finally it will burst and there is a fistula formation. So when the lacrimal abscess is left unattended, it discharges spontaneously, leaving external fistula below the medial palpebral ligament. Okay. This abscess rarely may open into the nasal cavity, forming an internal fistula. So instead of coming like this to the skin externally, if it forms a fistula internally, then there can be an internal fistula in the nasal cavity. Okay, so did you understand this fistula? So people, what are we looking at today? Acute DaCryoCystitis. In that we looked at the etiology, we looked at the clinical features in which we saw 3 stages. That is the stage of cellulitis, stage of abscess, lacrimal abscess, and the stage of fistula formation, right? So all this we saw. Now let us move on to the complications. Okay. So obviously what and all will it affect? It will cause conjunctivitis, right? It will cause acute conjunctivitis, right? Then conversion of corneal abrasion into ulceration. If there is corneal abrasion, that will become now a corneal ulceration. Then lid abscess. So it's affecting the eyelid. Then osteomyelitis of lacrimal bone. So lacrimal bone also is getting affected, myelitis. So what do you think will happen in myelitis? Basically it is the infection of the bone. Okay. So which bone is affected, guys? The lacrimal bone. Okay. Guys, the complications are not done yet. We have some more complications. Orbital cellulitis. Then you have facial cellulitis, acute ethmoiditis, then you have cavernous sinus thrombosis, generalized septicemia also can develop. So rarely it can go into cavernous sinus thrombosis. These are all very complicated, thrombosis, and then even generalized septicemia. So it is intersystemically, it is starting to affect generalized septicemia. Okay. So basically cellulitis means what? Infection by bacteria or something and swelling. This will lead to red swelling and all that. Okay. So that is only cellulitis. Okay. So it will affect what and all? It will affect the orbit, the face, and even the ethmoid, right? What is the ethmoid? Ethmoid bone. Okay. It is the bone. So here you can see. Okay. Ethmoid bone. Then, so now can you say, what is this cavernous sinus, guys? Cavernous sinus. Have you forgotten that? You remember these diagrams from anatomy? So this is the cavernous sinus. Okay. So here it is marked. See, cavernous sinus. That is what? This portion, right? Cavernous sinus. So you can see here how close it is to this. So here you have the lacrimal sac, which is now affecting what? It will affect this cavernous sinus shown here, right? Okay. So let's recap the complications of acute DaCryoCystitis. Say acute.
Acute
Conjunctivitis.
Conjunctivitis.
Corneal
Ulceration.
Lid abscess. Osteomyelitis. Orbital cellulitis. Okay. Can you say ethmoiditis? Can you say cavernous sinus? Thrombosis. Septicemia. Thank you. Okay, so we are done with the complications. Now let us move on to the treatment of acute DaCryoCystitis. Okay. So let us look at the treatment now of acute DaCryoCystitis. So treatment. So basically the treatment they had divided into 3 stages. During cellulitis stage, during stage of lacrimal abscess, and during fistula. Treatment of external lacrimal fistula. External, okay, they're talking about the external lacrimal fistula, okay. So let us look at the treatment. During cellulitis, what treatment will you give? Systemic and topical antibiotics. So basically they're just saying antibiotics, okay. Then you can give anti-inflammatory analgesic drugs, that is NSAIDs, right? Hot fomentation to relieve pain and swelling. So they are talking about antibiotics, anti-inflammatory analgesics and hot fomentation. Okay guys, so let's move on to what will happen in lacrimal abscess state. How will you treat? So basically in addition to the above treatment, so along with this treatment, now they are saying when pus starts pointing at on the skin, it should be drained with small incision. So basically when you are seeing the pus pointing, so you can see that in this photo they are showing actually the pus pointing, right? You can see the weakest point of the thing here. I am guessing, right? This is my guess, guys. This is pus pointing here. What do you see? So they can make an incision and drain it, right? So the pus is gently squeezed out, right? So you will drain the pus with small incision. The pus should be gently squeezed out and dressing should be done with betadine soaked roll gauze, okay? Then later, depending upon the condition, either DCT or DCR operation should be done. That is a dacryocystorhinostomy you will do, or you will do a DCT. What is DCT? DCT is dacryocystectomy. So DCR is dacryocystorhinostomy, or you can do a DCT, that is a dacryocystectomy, okay. So, okay, then they are talking about treatment of the external lacrimal fistula. So basically what they will do now, there is a fistula, right? There is an abnormal opening. So first they will do a control of this acute infection with systemic antibiotics, etc. After this acute infection is cleared, then they will do a fistulectomy. Fistulectomy along with DCT or DCR, okay. So what will they do? First, fistulectomy. Fistulectomy along with DCT or DCR. So basically, first you should control the acute infection with antibiotics, okay. So now is it clear, guys, the treatment for acute DaCryoCystitis, okay. So for this DCR and DCT, lot of surgical techniques and all are there. Like for DCR, you have like conventional approach, then you have an endonasal surgical DCR, endonasal laser DCR, Endocanalicular laser DCR. Lot of DCRs are there. And for dacryocystectomy, also there are some techniques. You can look at these details from the textbook. Okay. So let us revise what we have seen so far in this video. We started off with acute DaCryoCystitis. It's a putative inflammation of lacrimal sac, right? It is caused because of infections, right? A chronic dacryocystitis can have an acute exacerbation, or there could be acute peridacryocystitis. The organisms are Staphylococcus, Streptococcus, Pneumococcus, all that. Then you have seen the clinical stages. You have cellulitis, then you have the abscess, and then you have the fistula formation. Then you saw the complications like conjunctivitis, corneal ulceration, lid abscess, osteomyelitis, orbital cellulitis, facial cellulitis, acute ethmoiditis, cavernous sinus thrombosis, and generalized septicemia also can happen very rarely. Then we saw the treatment during cellulitis. Give antibiotics, anti-inflammatory analgesics, hot fomentation. During abscess, you can drain the pus, and then you can see if they need a DCR or a DCT. Then you can, if there is an external lacrimal fistula, first control the acute infection with antibiotics, and then you can do a fistulectomy along with DCR or DCT. For extra and more correct details, please refer textbook, because you should not depend on YouTube videos for everything. Okay, bye bye.